Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. It's November 6, 2024, and we are recording at 2 p.m. Eastern Time. Before we begin the show, we released a new issue of Health Affairs This Week with health insurance, pharmaceuticals, and more being a central piece. We included a study on the evidence that regulatory and market forces are driving adoption of biosimilars. One of the authors, Janice Jiang, appeared on our other podcast, Health Podyssey, with our editor-in-chief, Alan Weil, this week. Please check out the issue and that episode. And on November 20th, we are hosting a journal club with John Balbus for Health Affairs Insiders on nursing home, financial stability, and funding challenges. Insider is our membership program where you get exclusive access to events and premium newsletters. One of the authors of those newsletters is our guest today, Zachary from Georgetown's O'Neill Institute. And I'm also joined by our in-house lawyer, Chris Fleming. Zach and Chris, welcome back to the program.
Thanks, Jeff. Good to be here.
Thank you.
So at the time of this call, the presidential election was called for Donald Trump, and we are going to talk about what that might mean for the courts and healthcare. So just to start it off, Zachary, what do you see as the most important areas in healthcare in the wake of this election?
Well, thank you for the question, and thank you for having me on. So I should also preface that as we sit here today, the Republicans have flipped the U.S. Senate, and the House of Representatives remains too close to call. And so there is a possible universe in which the Republicans have unified control of the House of Representatives, the Senate, and the presidency. There is also a world in which the Democrats are able to narrowly flip the House of Representatives, which could have an impact on potential legislative reforms in the healthcare arena. Before I get into some of the specific health policy areas that I do think we should expect to see potential significant developments in, I do just want to note on a basic nuts and bolts level, the fact that Republicans will have control of the presidency and the U.S. Senate means that they will be able to confirm a lot of federal judges, at least in the next 2 years. And I think as we look back to what the Trump administration was able to accomplish in their first term, we saw not only at the Supreme Court level, but also at the appellate courts and at the district court level, they had a lot of success in getting many judges confirmed. And as we see more and more policies being challenged in the courts, whether that be laws passed by Congress or whether that be regulatory actions taken by federal agencies, the fact that we will have a more conservative composition within the federal courts does mean that a range of policies in the healthcare arena could face a more skeptical audience on the federal bench. Just briefly, and going through a few areas that I think are going to be really important to monitor. The first, of course, is the Affordable Care Act. We've had 10 plus years of legislative fighting and back and forth, and we've had 10 plus years, of course, of fights in the courts, both in terms of different existential battles over the law, whether the individual mandate and Medicaid expansion were constitutional, whether the premium tax credits could be available across the nation, and of course, whether certain employers and private insurers are required to cover the full range of FDA-approved contraception. On the legislative front, it is certainly possible that in DC, Congress, as well as the Trump administration, could again prioritize some form of repeal or significant reforms of the Affordable Care Act. Certainly at a minimum, I think the extension of the premium tax credit enhancements that the Democrats were able to achieve through the American Rescue Plan and the Inflation Reduction Act, which are slated to expire at the end of 2025, become a lot harder in the current climate, given, I think, unified opposition to extending those premium tax credits through, given the unified opposition to extending those premium tax credit enhancements. But there's also a lot of administrative options that a Trump administration could pursue to building on some things that they did in the previous term to make certain modifications related to short-term limited duration plans or other types of plans that don't have to provide comprehensive coverage, whether it's promoting other types of tax-preferred accounts to encourage different consumers to enroll in plans outside the Affordable Care Act marketplace. So I think when you look at sort of under the Biden administration, I think Affordable Care Act enrollment hit an all-time record high across the country. As we look at the years ahead, I think it is likely going to be challenging to maintain that growth in light of both legislative and regulatory changes that the Trump administration could make.
Before you go on to the next area, let me just one thing that's interesting, I think, in what you just said, sort of a theme that occurs to me, that there could be a real emphasis on sort of segmenting the risk pool, whether that takes place within a continuing Affordable Care Act, as you mentioned, with the short-term limited duration plans, association health plans, sort of increasing access to those sorts of plans that aren't subject to the same sorts of rules about bans on underwriting and that sort of thing that normal ACA plans are. Or it might take place on a sort of broader scale if they were, as you mentioned, they might try to undo the ACA or at least alter it significantly. We had J.D. Vance talking about, maybe trying, why are we trying to stuff everybody into the same pool? Why not, separate out, put the high risk folks here and the low risk folks there. And that sort of harkens back to sort of an old, Republican theme, the high risk pools that were popular, some time ago. So it sounds like, whether it's within the ACA or changing or repealing the ACA, we could see this theme of segmenting the risk pool and sort of reversing the direction that the ACA went, where they put everybody in the same pool.
I think that's right. I think there's two routes to get to that goal. There is a broader legislative package that does so, or it's a question of, let's say if the Republicans say they want to prioritize taxes or immigration and say, you know what, we're not going to spend all of our legislative energy on another big type of reform to the Affordable Care Act. Instead, through HHS, through the federal agencies, they could try and find other routes to boost up some of these other markets and try and make an argument that they are making health coverage more affordable because it may not cover all these comprehensive benefits. Turning back to the courts, then the question is whether opponents to those measures then I think would try and bring litigation to try and block some of those regulatory initiatives. And in a world in which we don't have the Chevron doctrine anymore, it may well be that some of those attempts are more legally difficult to achieve from a regulatory perspective.
And I want to let you, I know you've got some other buckets you want to cover, but one thing would be interesting, and I guess we've tried and failed to limit or abolish so-called judge shopping, where you've opponents of the ACA in particular have been able to find these sort of smaller districts or even divisions within districts where there's only one judge, and been able to target sympathetic judges, and so that obviously makes it even easier to challenge something in the courts. But let me let you respond to that, and then let me let you go on to the next buckets.
Look, I think that's fair. In a world in which there is not a legislative approach to restrict certain forms of forum shopping, I think it is reasonable to expect that state attorneys general, public interest organizations, and other savvy plaintiffs are going to continue to find ways to bring cases in front of judges that they think are going to be more friendly to their arguments, as long as they meet the requisite standing and venue arguments to bring those cases. Then I think we're going to continue to see some of the trends that we've seen in recent years, which I do think, again, will just have the courts being more central to the health policy process.
So you wanted to address some other buckets of health policy. What else are you thinking about?
Thanks. So certainly on the campaign trail, there was a lot of focus of the Trump campaign saying that they're going to protect Medicare and Social Security. But I think left out of that discussion was Medicaid, which of course covers tens of millions of low income and working folks, seniors, and people with disabilities, including through the Affordable Care Act's Medicaid expansion that really touches almost the vast majority of low income adults. So the fact that Medicaid, I think, was left out of that conversation suggests that it may be an area that the Trump administration and congressional Republicans pursue to try and find federal savings and rework the Medicaid program to give greater flexibility to states to pursue different options. Certainly, we saw during the first Trump administration them pursue things like work requirements and things that would impose other conditions that would make it harder for certain folks on Medicaid to maintain their coverage. But we also have seen discussion of things like Medicaid block grants and other types of per capita grants or cuts that would severely restrict the amount of federal dollars that are going towards the Medicaid program and create greater flexibility for states to decide how to run their Medicaid programs. Certainly, Republicans have supported these proposals and initiatives by saying that it's an important measure to bring down costs and bring the Medicaid program closer to its original intent. Experts on the other side have a lot of concerns about saying that actually the intent of the Medicaid program is to cover the most vulnerable, provide this guarantee of coverage, and that saving certain federal dollars on Medicaid coverage could have other harmful impacts when you think about things like education and other types of tax receipts and uncompensated care and things like that. And so I think certainly there will be, I think it's likely that fights over Medicaid at both in Congress as well as at the federal agencies will remain a big topic in the years ahead.
Well, and that'll bear watching, I think, particularly because it comes on the heels of the great unwinding, the sort of end of the continuous eligibility that took place during the pandemic. So obviously the measures you're talking about would have a big impact on Medicaid regardless, but coming on top of the millions who have left the rolls in recent months, that impact will only be magnified.
I think that's right. Certainly, if we think about what we saw during COVID in terms of the substantial increase in enrollment on Medicaid, and now through this unwinding in terms of millions of people now losing their Medicaid coverage, some going to the Affordable Care Act marketplace, some going to employer coverage. I think if we think about, of course, both letting the ACA premium tax credits expire, plus other big types of Medicaid block grants, the combined effect could certainly be a significant increase in the number of uninsured Americans.
Well, what other areas should we be watching here?
So another huge area is going to be in the context of abortion and reproductive health care. Of course, that was a topic that was front and center on the campaign trail, both in terms of the record of former President Trump in terms of his Supreme Court appointments and the Dobbs decision overturning the right to abortion. The stance that the Trump campaign tried to take is that this is now a matter for the states. And of course, one thing that we did see through the results of the election is that at the state level, a number of referendum enshrining the right to abortion at the state level passed. Some of them, if you look at Florida, it got more of a majority vote, but it didn't hit that 60% threshold that they needed under state law. But broadly, if you look around, you see that the public, when they're able to vote, they do vote to support enshrining greater access to reproductive health. So the first question is whether we are going to see congressional Republicans try and take any type of legislative action to put in place new restrictions on abortion. Certainly, that could look like something like a 15-week or a 20-week ban or something like that. But also, they could certainly move to put in place new restrictions on access to mifepristone, abortion medication, or others. They could also move to put in place new different types of religious conscience exemptions that would make it more difficult for people to access reproductive health care. If they didn't want to take action at the legislative level, or if, let's say, Democrats controlled the House of Representatives, instead, I think it's certainly fair to imagine that the Trump administration would consider pursuing a number of steps that could restrict access to reproductive health care, from cutting off certain funding to Planned Parenthood, restricting and limiting certain family planning grants to organizations that provide referrals for abortion services. And I think most critically, in the context of access to mifepristone and access to abortion pills, taking certain steps to either make it more difficult for women to get access to mifepristone, or even potentially trying to revive things like the Comstock Act, in which would criminalize certain mailing of abortion medication across the nation. And so, in some respect, the actions that a future administration could take through the FDA and through the Department of Justice could, even without Congress taking certain action, almost secure a form of a nationwide abortion ban. Now, of course, some of those actions could face their own legal challenges in court. And I think there are a lot of steps to play out on that front. But I think whether it is certainly fair to expect that the Trump administration will take certain actions to make it more difficult for women to access comprehensive reproductive health care.
Well, and I would say it was noteworthy that we were talking about a statute as old as the Comstock Act, had we not just spent a lot of time talking about the Alien and Sedition Act, which I think dates from like 1797. But that's another story. I know that you also wanted to at least touch on the public health and vaccine element of things. So why don't you go ahead and do that?
Yeah, so certainly I think in the public health context, which I think a lot of us became more familiar with different state and federal authorities at the height of the COVID pandemic, certainly I think the traditional view had been a lot of these public health decisions are made at the state level when we think about different decisions about certain vaccine requirements, decisions that schools make in terms of conditioning enrollment on certain vaccination requirements. But I think if we look at the discussion and the campaign trail towards the end, and RFK Jr.'s endorsement of Trump and a number of statements that he made in terms of saying that he believed that him and Trump had discussed some type of senior White House role in which he would have greater authority in dealing with issues like vaccines and things related to FDA approval. I think it's fair to consider that there will be a renewed focus on certain federal levers that they can exert in terms of different forms of communication related to vaccines, whether it's trying to condition certain federal funding or grants related to vaccination and other different types of public health campaigns. If we think back to things we saw in the first Trump administration, even in the context of immigration, in which, and we saw some of this in healthcare too, anytime, of course, the federal government tries to condition federal grants on different new requirements, that does also run into potential litigation. So one more issue that I would like to discuss is the Medicare drug negotiation program under the Inflation Reduction Act. So the Medicare drug negotiation program, which was really the signature healthcare achievement during the Biden administration, that was passed on a party line vote in Congress. In the months leading up to the election, the Biden administration announced the results of the negotiated prices with the drug companies and outlined savings of billions of dollars for the federal government and seniors, but those prices don't take effect until 2026. And so the fact that the Medicare drug negotiation program was passed on a purely partisan vote, and we have certainly seen congressional Republicans make certain noise about different reforms to the Inflation Reduction Act, In a world in which they do have unified control of the House, Senate, and the White House, it is possible that they may try and consider some type of legislative reform, either to delay or water down the drug negotiation program. At the same time, they may face political hurdles in terms of seniors and others being concerned about the federal government losing a tool to bring down drug prices. The other option the Trump administration could pursue is to try and take certain administrative actions that also delay or weaken the implementation of the law. And the negotiation program is still in the midst of active litigation. We're still waiting for certain decisions at the district court level. There are a number of cases now on appeal. There was just oral argument in late October in the Third Circuit Court of Appeals and multiple cases. And so it is also possible that the Trump administration could make certain decisions related to the implementation of the law or the defense of the law in the court that could affect whether or not the negotiated prices fully go into effect for 2026. And so I think probably decisions about the drug negotiation program will have to be made in the context of other types of actions that the Trump administration and Congress are considering when it comes to bringing down drug costs. Certainly, we've seen discussion about reforms to pharmacy benefit managers and increased transparency on that front, some of which have attracted bipartisan interest. And so it may well be that you could see the Trump administration and congressional Republicans try and push more reforms to practices by pharmacy benefit managers instead of messing with the drug negotiation program. But we're going to have to wait and see.
Well, I mean, thanks, Zach. This has been great. And there are obviously a lot of other areas that we could talk about that are going to be hugely important and may see big changes, policy related to guns and gun control. We have all these other provisions in the IRA that relate to provisions addressing climate change, which obviously have huge health effects. But as I say, we can't hit everything. And you've done a great job covering a lot of stuff. So thank you very much.
Chris, thank you for joining us today. Zachary, thanks for joining us today. Lots of information. If you, the listener, enjoyed listening to this episode, please subscribe to Health Affairs This Week and send this episode to a friend or colleague. Thanks again, and we will see you next week.